what is the place of antibiotics in as much as managing the wounds is concerned? Yes.
Antimicrobial management, there are two ways in which you're going to introduce antibiotics to a patient. One, you're having local infection, to mean the infection is just localized on the wound. That means you put antimicrobial dressings. Then when you're having a systemic spread, or this infection is now getting into the system, it's beyond the wound. That is when you take either oral or IV antibiotics, plus the antimicrobial dressings. So when you're looking at now the signs of infection manifesting in this patient, that is what dictates if the patient will be able to take oral antibiotics or maybe IV or injection antibiotics, or just dressings which contains antibiotics. So you need to split the two. You don't want to give this patient antibiotics all through. Patient takes, it will be unnecessary. If it's just localized infection, an antimicrobial dressing is enough. If it's getting systemic, that's when you introduce systemic antibiotics. Yeah.
Now, back to the type of wounds. So if there are type of wounds, it means there are types of dressings. Yes. Please talk about each type of dressing specific for which wound.
For which wound?
Yes.
That is extremely broad. The market is saturated with advanced, that's why we hear this, advanced wound specialists. The advancements because of science. There's a lot of research and analysis outside here. So we have, for instance, what we categorically call foam dressings. Foam dressings, these are meant to absorb exudate, that fluid coming from the wound. Some of these foam dressings, those which contains antibiotics, some don't. So for infectious wound or for infected wounds, use those ones with antibiotics. If it's plain, it just means just to absorb that fluid coming from the wound. We have advanced options like what we call the negative pressure wound therapy. This is a device which is normally connected on the patient to help remove maybe fluid accumulation, to help tissues stick together. Normally is a lot post, let's say, orthopedic surgeries, maybe post debridement, post skin grafts, just to ensure there is tissue cohesion and removing both the fluid and maybe infected, those infected fluids from the wound, bacteria, with everything normally comes out. We have therapies like we've heard of hyperbaric oxygen therapy, or maybe the transcutaneous oxygen administration, whereby you suspect maybe there is limited or less tissue oxygen. The concentration of oxygen in the tissue is limited. Remember, oxygen is a crucial element when it's coming to wound healing. So if you suspect there is less tissue concentration of oxygen, then you have patients being put on hyperbaric chambers or transcutaneous administration of oxygen. You're having gels. There's some gels which is available in the market. These gels are either used to either moisten the wound or to debride. Normally in our language we say autolytic debride, just to remove the dead tissues. It helps to break down the dead tissues. So we use gels. We're having things like growth factor concentrate, or the platelet-rich plasma, whereby we call them, when talking about regenerative medicine, they're just those stubborn wounds. You've also heard of fat graft. This is a different intervention, helps with regeneration. So in such, you just take the patient's either fat tissues, they're normally concentrated, maybe running a device, then they're injected back in the wound. They quicken the healing process. It's just jumpstart the wound again. So that this is an available technology as well. The dressings are many. You have like activated charcoal dressings, which still also contains antibiotics. Not really absorbent, but maybe for those smelly wounds, you need to take care of the odor. They come really handy. There are many. I cannot be able to exhaust the list. It's a long list. But trickles still down to assessment. You assess the wound, you can be able to get a whole list of materials according to your assessment, depending on the wound status.
Well, for somebody like me who grew up in the rural areas, I saw a time when our older parents used to, you get a cut unasikia amekwambia weka chumvi. Is it recommended?
Okay, in such a setup,
Yes.
I can be able to say yes. In an ideal setup, no. Huh? But in those setup, remember this salt concentration is going to dehydrate, even including the bacteria. Ile tulikuwa in school we used to, in biology, I think, or chemistry.
Yes.
Remember we were talking about diffusion or osmosis,
Yeah.
movement of molecules from one area to the other.
Yes.
So you put this salt concentration, the salt is of a higher concentration than that one in the bacteria or in the cells. So it will be going to have some kind of a bacteriostatic effect, whereby it takes in the moisture from even the bacteria, from the surrounding tissues, and tends to dry it up.
So the idea was it will stop the bleeding.
Bleeding, not as per se, but okay, to some degree it worked. But okay, in that setup,
Yes.
it may be a deal as those initial first aid before maybe something can be done.
Yes.
Yes.
Talk about symptoms of an infected wound. Yes.
This is really critical. Manifestation, let's say like pain. That's normally one of the factors. We talk about erythema or reddening of the tissues around the peri-wound skin, the immediate adjacent skin after the wound, peri-wound skin, erythema or redness.
Yes.
To some patients, they have either a lot of leakage, you call it a lot of exudate, which at times might turn purulent, or maybe it, I don't like using the term pus, but it's a common language. We call it purulent exudate. We have element of even skin or the tissue changes color. It darkens in a way that it's not healthy. Healthy tissue is beefy red, we call it beefy red. When it starts to darken, it means there's some element of infection as well. Exudate, we talked about increase in exudate level. Some get smelly.
Yeah.
And then to some, depending on which bacteria are present, they change color. There's a common bacteria, it's called Pseudomonas. Normally it turns to, makes the dressing material and the wound start turning green. Maybe you've seen such instances because of presence of a particular bacteria.